Everyone, again, sorry, I don't have any music. Maybe next time. I'm glad to see many of you are here today. That's good. Those who had a class at 8 o'clock. Did you have any earlier classes? They had a hard time coming in, and especially in Rochester. Rochester, can you hear me okay?
Yes.
Good. So, Mike, if you want to go ahead and start the recording, that would be great. Thank you. So we're going to record because I understand a few people may not be able to make it. Still, some driving conditions are dangerous, especially south of here in Rochester. Around some of the highways we're still closed. So we're going to record this, and once it's available, we'll post that for your enjoyment. If you don't have anything to watch on Netflix or whatever, you can watch my action movie. Boring, I guess, but well, that's what you got. So today we're going to have a lot of interactive activities other than just talking to each other for a reason or without a reason. So let's keep that to a minimum. Community nursing, how to do continuing nursing assessment, and now after you've done your windshield survey, I take it that you're becoming more and more experts in doing that, and you've learned a few things, and we'll hear from you toward the end. We're going to go over the lecture, do these activities together, and then we'll split from Rochester toward the end, and they can present their findings. So we'll ask each team to come out here to represent their group. We will be talking defining health, as I promised from your definitions from last week. Put something together, kind of a summary, which is interesting. Every semester we do that, and very, very similar ideas and diverse opinions on the definition of the family, but I try to kind of tweak it to fit what your definition as a group is. And we'll also today define health. You'll have a chance to bring in your Have you guys used Wordle before? This where you've seen it probably in posters, these big words and small words like a cloud. We're going to do that with health in a quick survey as well. Anyway, so to start, I wanted to show you what I put together. Where does it go? Health, definition of health. I can't even see anything. What is health in your words? Can anyone see that? I hope I didn't delete it. I thought I made it. Family. Oh, I'm looking for definition of health. It's family definition. I'm sorry. And actually, it's up here. All right. So, yeah, that's what happens when you get old. So don't blame me. So defining family, let's start here. As we discussed last week, the definition is very dynamic, very fluid. It can be seen as a unit, as a building block of society, or as a system. So this is kind of where people saw the family as either a cellular level definition or a systematic level definition. So it could be both. And in terms of structure, these are some of the ideas you guys contributed. Group of people, obviously, and it could include other than just human beings. But mostly, people are connected together in one way or another, either biologically, genetically, emotionally, in terms of goals, values. It can be diverse within the same family. The diversity can be found. Generations can be also in the structure. As you can see, it's really wide and open to anybody's perception of what family is. And these are some of the characteristics of a family. There are shared values and identity, so you can identify with a certain family. It could be your father and mother and siblings, or we can define ourselves here as a nursing professionals family. You can belong there too, because you share the same or similar values and identity. Families is very significant in one's life, whoever belongs there. It's the constant, and especially if we were talking about care of families, the family is the constant in the patient's or the child's life. Other than, if you look at other health professionals or some people who are trying to help, or the babysitter or whoever, these are people come and go. But the family is very unique and is there to stay. Functions, lots of different functions: biologic function, emotional, psychological, in terms of support and help and finding solutions for each other, giving each other help when they need it. That happens all in the family. Obviously, in addition to reproduction and maintaining our human race going. And these are how the family functions, the dynamics of family, connection between members, interrelationships, which are not always, in going in the right direction. Things happen up and down. Happiness, sadness, conflict, all that happens within the family. It's part of a system. It's like your car. When it's brand new, it's functioning. After a while, you need to maintain it. If you don't do that, start spending a lot of money on it. And as you can see here, you can take a minute and read that and tell me if you like to add more, if you agree with it, disagree. If family definition in Rochester is different than Minneapolis, I don't know. Okay, any thoughts, ideas, feedback? Does it kind of cover what do you think we should think about family when we approach the subject? Okay. And I just opened the link if you want to access it. Family definition. Oh, no, I didn't. Here it is. All right, so now that's out of the way. We move on to the feature presentation. No pun intended. When we talk about community assessment or community nursing in general, some people might say, community nursing or public health nursing. And by the way, this is kind of on the side, and it's a perk for you. When you finish your nursing program, you can apply, when you get your license as an RN, you can apply to have also a public health nurse, PHN, attached to your name. So you get that as a freebie because you've done all the courses, you've done all the clinicals, and you get that as a license or a certificate as a public health nurse. So don't forget to do that. Okay. Anyway, so the difference between community-based nursing and public health, they're sometimes interchangeable, but a public health is concerned with the bigger population, say the population of the United States, or the world, or the entire people of Minnesota. These are kind of public health focus. A community is a little smaller. Could be similar issues, similar problems, or health promotion in this community might be different from that. That's where you focus on a specific community, like sophomores in school and nursing school who are sleep deprived, okay, or they work 2 jobs and they don't have time to focus on their self-care and studying. That could be a specific community you want to work on. So there you have it. But many times they're very similar. They use the same terminologies. They use the same, lingo. So that shouldn't confuse you. Public health in general, obviously, it's something. It's a body of knowledge, an organized body of knowledge that concerns itself with the health of the public. Obviously, the larger community that people live within, and focuses on how the diseases or epidemics originate and spread, and how we can prevent them, how we can improve the health of certain community or the overall population. And now, hearing about the Zika virus, this is kind of another public health big deal going on these days, and how all kinds of agencies are coming together, even governments. They're putting all their resources in order to track and try to stop it and find ways to prevent that from spreading to the general public. And as a public health nurse, you have certain skills and knowledge that you should have to be able to be a successful public health nurse. If you work for, say, the Minnesota Department of Health or work for another organization, they will look for these skills. And, as you will learn in public health courses and in the clinical, what these principles are, not just in the classroom, but you will be able to apply them. You'll be able to use some of those skills on the ground, and those could be your best friend if you want to practice in public health or community health nursing. So analytical skills, policy, and program development. So you think from not just, okay, we have a patient who has a blood pressure that's high, but we're looking at a bird's eye view at the community that has high blood pressure. Why this group of people, have a high blood pressure. If you look at the numbers that come from the state Department of Health, why a specific community has an outbreak or low birth weight or whatever the issue might be, you don't just focus on the one patient, although this is a care of families, but these are principles that when you are a public health nurse, you look beyond what just the immediate problem. You have to be good at communicating with others. This is a great skill to have when you communicate, how to communicate clearly, and when you use data, how to interpret the data and be as objective in describing the problem, which will help you in finding solutions for it. Also, cultural diversity. Like I said, when we look at the bigger population, we're not just looking at one culture. We're looking at a more diverse population. Why does something happen in this ethnic group but not that? are there any cultural underpinnings or risk factors that happen in one culture than the other. Community dimensions of practice, again, your focus is bigger, not just the one patient or one family. And also basic public health sciences, you'll get more of those, how to track diseases, what is prevalence, we'll talk about a little bit of those definitions, mortality, morbidity rates, all these terms, and what are the tools that you use as a public health personnel to conduct your work. And also leadership and financial planning. You'll be responsible for programs. You'll be implementing programs, probably writing grants to implement teaching program in the community for some group. And those require you to have those skills, how to allocate resources and money, and how to lead projects, how to collaborate with others in doing that. So some of the public health sciences, this is kind of a basic. If you do some a Master of Public Health, you'll study epidemiology, you'll study environmental health as basis. These are kind of the ABCs of the public health sciences. But for now, we'll just touch about a little bit on some of the terms that we'll be talking about, and you might hear every now and then. For example, epidemiology is concerned with or focuses on the distribution of disease or injury, where it starts, what are the risk factors, why it happens here, and when it happens, epidemiologists will be all over the place, trying to put together, how it started. I'm assuming some of you probably at some point have been eating at Chipotle, and we've heard all the stories about contamination. I tell you, public health people were very, very busy trying to identify how it started, where it came from, contamination. Is it the tomatoes? Is it the lettuce? Is it whatever? This is kind of where public health comes into practice. Morbidity, of course, it's kind of the sickness. That's another way of saying being sick. Mortality is death, of course. Incidence is what the number of the incidence of flu this year or Zika virus. How many cases? How many new cases are identified every year in a particular area or whatever the geographic area is, but the prevalence is how many cases are there total. So if we say there are 1,000 cases of gastroenteritis in let's just say Wisconsin, not Minnesota. The incidents happened over the last year. Okay, but how many happened the last year and forever? That's the prevalence. How many of the population are sick of this particular disease? Any questions on this? They're pretty much self-explanatory, right? And this guy is very important to understand, the triangle, the public health triangle, or epidemiologic triangle. And actually, I stumbled upon something I wanted to recommend to you, and it's I put the link on that, so that kind of gives you a different perspective. When we think of public health, the community, we think, oh, a virus or a food contamination, or what's happening in Michigan, the water is contaminated, right? Anything that affects the person's health in a physical or physiological way. But there's a TED Talk by a physician who is an epidemiologist, who he traveled the world and worked for WHO to basically do public health work, all right? But when he came back to the US, what he started working on is not, gastroenteritis or cholera in Somalia or malnutrition and whatever. He started focusing on crime or violence, okay? And he saw that as a contagious disease. and use the same methods that we're highlighting here in this triangle, right? You have the host, or starts with the agent, the environment, and the host, okay? The agent is whatever the risk factor, or let's say the bug, what causes the illness. The host is where it goes and causes the disease, and the environment is where it thrives and grows and multiplies and waits for the host to come in and, infect them, right? This is kind of our understanding of the physical disease. But he saw it from a different perspective. It's really intriguing talk that when he started working on violence in some neighborhoods, just by going in, talking to people, trying to build or teach the youth about nonviolence, the rate of homicide and injuries from violence dropped in really significant numbers. And that's where, when you are the public health professional, you want to target a problem, preferably in all these areas. If you have a bug, the bacteria, just hygiene, for example, washing hands will get rid of some of those bacteria, right? If you are the host, how to protect yourself. If where the environment it grows and prospers, you want to decontaminate that. So you prevent or break the chain of action, or one of those corners of the triangle. If you intervene or break that cycle, break the cycle. It's not a triangle, but you get the idea. If you remove one of those, you'll be successful in stopping that one point leading to the other where the agent is not going to affect the host. Okay? So if there is violence in the street, if we teach the youth to stay away from violent behavior or find a better way of spending their time, then they're not going to be seeing someone else committing a crime, or they themselves being a victim of it or a perpetrator of the crime. Or you can teach or change the environment itself, improving living conditions, improving education. That will lessen the impact the environment has on people who live into it. So the epidemiologic triangle, you have these three main components. If we intervene to fix one or more, then you have a better luck in stopping an epidemic or disease or a problem within the community. Of course, economics have a huge impact on the public's health, and specifically living in this country, where everything, pretty much wherever you go, it boils down to money, right? If there's poverty, there's unemployment, then you see a lot of health problems, a lot of behavioral problems, crime, etc. And anything that as a health professional you do, eventually it's going to cost money. So how do we use that money? How do we allocate and design programs that don't necessarily, we've heard the term, we can't just solve it by throwing money on it, right? We're just going to solve this problem by just throwing money. Meaning, whatever you're doing is really just spending money and you're not doing any good, right? But where that money is allocated and how you spend it and in what way is the key. For example, here are two examples. One is the hepatitis B vaccine, okay, or any vaccine, right? The vaccine, it costs maybe $1, the shot or the injection. Let's just say it costs $100, okay? I doubt there's any vaccine that would cost that much. How much do you pay for the flu shot if you have insurance, obviously, that's covered, but if you don't have insurance, say, you go to Cup Foods or to Minute Clinic, you pay like $10, right, for a flu shot. But how much will it cost you if you get sick with the flu and go to the hospital? right? And here, hepatitis. If you spend that, say, $100 on an immunization for a child, as opposed to them having hepatitis and being in the hospital, or worse yet, if the liver fails and then they need a liver transplant. You see, with that little investment, you prevented a huge problem in the future. Same applies to prenatal care. Since this whole course we're talking about, promoting the health of the family as it kind of gets into from one developmental stage to the other, as it grows, as it becomes bigger. We want to focus on those areas where we can help build a healthier individual from the very beginning. Very good example also is prenatal vitamins and supplements. Okay, folic acid, I believe, if I'm not mistaken, very, very cheap. But if the moms have enough supplement before or during pregnancy, it prevents neurological defects in the newborn, something we call spina bifida. Maybe you guys have heard of that or seen that. And that can render the baby could be significant disabilities, neurological, movement, all kinds of disabilities for life. And folic acid is next to nothing, the cost. Really, you can buy it over the counter. But if you can tell the mom that this is important and you deliver that message, you make huge difference, big impact. So we don't always know what the problems of a certain community are unless we really ask the questions. And being a member of a community, and kind of that was the idea behind sending you to the neighborhoods that you're familiar with, places places you've live near, so you can make or take another perspective or different look than just rushing to class today. I don't have to look at the streets or the buildings or anything around me or the traffic or safety, all that stuff. But you just have one kind of laser point vision and just going to your class and you don't look again. But as a healthcare professional, you look and you critique what you see. And those are the parts that we use in assessing the community. I know that a lot of this sounds redundant, but assessment is the mother of all skills of any nurse. Okay? Whether it's in the community, whether it's in the hospital, in the clinic, unless you know what the problem is, you will not be able to solve it. You have to identify what these weaknesses, challenges, problems beforehand in order to intervene in the future. So, start with assessment. We're going to look at that in a minute. These are kind of they're in the slides and also on the website. These are our objectives of this part of the lecture. I'm not going to read them. They're, I understand everyone can read and write here, right? Good. And here's, again, the definition of a community. It's more localized. There are people who live within that community. They share values. It's kind of similar, very similar to a family definition, but at a larger scale. Okay? And instead of focusing on the individual, one person, you have a patient assignment in medical, surgical, or OB, or whatever, you have a wider lens. This is our focus in community health. It could be heavily focused on one topic or one problem. You can be a public health nurse or a community health nurse or a home visitor nurse and focus on teaching or focus on smoking cessation or teen pregnancy or violence or, you know, whatever the topic, immunizations, any of those, but those are kind of your area of specialty, but all fall within the community. And the individual focused approach that has been and is still mostly the focus of the healthcare system in the U.S. is not working very well. And again, like I said before, everything translates into money at the end. The U.S. spends on healthcare more than any other country. And if money was the problem, we spend more than any country. In fact, we spend more than the next, I can't remember, like 5 or 10 richest countries in the world combined on healthcare. And out of the GDP, it's just something I can't even imagine the difference of how much money the U.S. spends on healthcare. But is it making us healthier? Is it improving or changing the health outcomes of individuals and communities? Not necessarily. So can't just throw money on that problem. So here we focus on, in this course, we focus on the greater community, the bigger picture. So the impact is wider and more effective to help everyone. So here, for example, because of the cost, hospitals are becoming less and less the focus of care. And that makes sense. I remember when I was a nursing student, we had, say, we took care of patients who, say, had, you know, a surgery because of inflamed appendix. Someone comes the night before, had appendicitis and then appendectomy. How long do you think they stayed in the hospital then? Can someone throw a number? A week? Anything else? At least. Right, at least a week. And if they had, of course, if they had an infection or something, it could even go more. But now, you get the surgery. Has anybody had appendectomy done? Oh, that one. All right, 2. How long did you stay?
A week.
You stayed a week. How long ago?
10 years ago.
10 years, okay.
Mine's about the same. I think it was only like 2 or 3 days, and it was when I was 9, so 10 years.
Okay. Nowadays, even, it's shorter. Now it's just done, and hardly you stay for 24 hours. There's something called 24-hour observation. So you get the surgery, come back, you recover, everything looks good, you go home, come back, and do a follow-up in a week's time, and you're done. So you finish your recovery at home, because it's very expensive to stay in the hospital. And not only the surgeon who's going to bill you, you know, God forbid you don't have insurance, because everybody will send you a bill. The surgeon will send you a bill, the hospital for the facility will send you a bill, even the person who pushed the wheelchair when you came in, they'll send you a bill, the anesthesiologist will send you a bill, the cleaner, no, you're not the cleaner, but everybody will be asking you for money. I mean, 10 years ago, I had just a scope for my knee from an old soccer injury, and it didn't do anything, just there are some old tissue scars, they cleaned that up because it kept inflaming. And when I looked at this, I mean, it was an hour to be in the procedure, and then 3 hours later, I was taken home. More than $8,000, the total bill for that, okay? So you can imagine if somebody doesn't have the money to pay for that, it will be devastating. And actually, we have a video. If some of you have seen the link, Sick Around the World, it's a PBS documentary, and there's a link there. It compares how other countries, they put these resources into action and changing the healthcare system in order to get the best results for everyone. So you have not just, you know, poor countries or, you know, third world, but, you know, big capitalist countries. You have the UK, you have Germany, got Japan, all Switzerland, all these people. None of them have the same system as here. And it's kind of an eye-opener for us to see what others are doing, how the healthcare system can be improved. I'm not advocating we should follow, the UK in their system. We might have different and even better system. But looking at other people's experiences helps us understand what the problem that we're running ourselves into. And a couple of years back, there was a huge debate, if you were following the politics. There was a lot of politics involved in healthcare, and debate between supporters and opponents of the healthcare reform. And until today, people in Congress try to repeal the Obamacare, if you will. And that, there's always that contention between politicians. And why is that? Because there are some interest groups behind them, supporting them financially, and then they want those politicians to do what is favorable to health insurance companies. There was a piece of news the other day. United Health Group is one big insurance and healthcare company, and they're saying the health reform, the new healthcare system, insurance, is costing them billions. So they're not making as much money, and they're not very happy about that. Of course they're not, because their stakeholders are not happy. They want the old system to come back so they can make all that money out of you and you and you and me and everyone else. I don't like that. We're moving toward more faster transfer from inpatient to outpatient or home care. We're moving more to more sensitive, more culturally sensitive, more people who know to work with certain communities, understand them, maybe have good experience with these communities so they can be a place of trust between the health educator, for example, and the Hmong community, for example. Somebody speaks the language, knows the customs, would be better equipped to deal with this community. Prenatal care, absolutely. And these are just some numbers here. It shows where, some of the prenatal care adequacy. Most of the U.S. here, 74% or 75%, is adequate or adequate plus. So that's good, 75%. But we still have areas of improvement. Some here inadequate, we have about 11% of women who don't receive enough prenatal care. So that's not good. In Minnesota, it's about the same, maybe a little less, but there's still about 9% inadequate prenatal care. And we know how important that is for the health of the mother, the health of the baby, and in the future, that baby will be the parent of another child. So imagine the chain reaction. And there are lots of gaps in the current system. There are, depending where you live, what your income is, what your level of education, it will impact your health. Okay, there are lots of differences. If you look at by age group, by education level, ethnic group, if you're an immigrant, all these have differences. Really important to know. For example, maternal mortality. Okay, since the 1980s, it has not decreased, and I think that's a shame in our system. We have all these high-tech stuff. You do an MRI or baby monitor, and it costs $1 million in the hospital, but we still fail to provide 10 or 12% of women proper prenatal care. I think I'd rather spend that money on immunizations, on nutrition, on supplements, prenatal visits, than fancy big equipment. Because that will prevent those problems from happening in the first place, and you don't even need that equipment. Infant mortality is one big indicator of the health of the community, and there's a lot of gaps in health in infant mortality among different groups. For example, African American, Hispanic, and Caucasian Americans. And one expert from the WHO once wrote, I don't need to go and read numbers when I go into a country to know the general health of the population. I just walk in the street and see mothers carrying their babies to see the health of the babies, how they look. Are they well nourished, or they look very starved and very skinny, and they don't look healthy. They just look in the street, see how the cleanliness in the streets, how do the neighbors look, how the houses, exactly what you guys are looking at in your windshield survey. And here's some distribution of low birth weight in the US. None of the states have done or reached the, wait a minute, I'm sorry. No, actually there are some in the low birth weight. Some achieved the the US standard was 6, I think. I don't think any state reached or the goal of the 2010 goal. But some are better than others, as you can see. Some are still, these are percentages of low birth weight among live births. So 8.8%, which is the highest, you can see it down here, in 16 states. 7.3 to 8.8% is in 18 states, and only 17 states are under 7.3. But the goal of that of the 2010 low birth weight percentages was not met. And then Minnesota, we're 5.6, so we're much better than others. But still within Minnesota, there are differences. Some counties are higher than others. And by the way, these are Hennepin, Ramsey, and what's the other big one down here? I can't remember. Washington? Anyway, it looks big. It looks the dark purple, right? And that's the high percentage. Can anyone tell me why? Or from what you see in on the diagram, why it's more in the Twins? Let's say the Twin Cities area or the Twin Cities counties. Can anyone guess why? Economics and stress. Anyone else? What do we have here in the Twin Cities? We have huge medical centers, right? You have the University of Minnesota Medical Center, you have Children's Hospital, you have North Memorial, and all the others, right? And if you have a high-risk pregnancy, where do you send them? Here. Exactly. So you have a lot of incidents happening here, but that doesn't mean the general population is the incidence of low birth weight is higher within the general population, but the incidence overall, because of the nature of this setting, is very, very high acute. The other flip side of that is also the premature birth as well. They will come here, and you'll see that also as a high percentage. But in the past, maybe the color would have been different because the low birth weight or the premature birth would have been counted with the mortality rate rather than the low birth weight, because they're still considered to be live births, so they belong to a different statistic. So again, using your analytical mind, you can tell or differentiate. Don't just take numbers as is, because there is something behind the numbers. So digging a little deeper, asking more probing questions will give you better answers. And in the US here, okay, so I take this one back. I think these 17 states met. Okay, this is the one I was thinking about. The preterm birth, none of the states met the objective. Okay? Many of the states, 23 and then 28, where, the 23 states were 12.8% preterm births per 1,000. Okay? And that is not acceptable. And you can see where all these areas are. And none of the U.S., any state of the U.S. met that goal of Healthy People 2010, HP 2010. Now it's, of course, we're in Healthy People 2020 goals, and hopefully we'll do that. But there's a lot of work to be done. That's kind of the take-home message. And in order to improve those statistics, we need to be aware of different kinds of preventions. You may have seen that in the book, you may have seen it somewhere else, but those are very basic public health, community health terms that you will use all the time. Primary prevention, secondary prevention, tertiary prevention. Okay? Primary prevention is the very first step of improving people's health. So when you give someone the person or the community doesn't have to be sick in order to receive primary prevention. Otherwise, that would be either secondary or tertiary. When you start with primary prevention, an example would be teaching people about nutrition, teaching people about exercise, teaching people how important it is to get your vaccines, for example. So anything you would do to prevent, before it happens, to prevent illness, to prevent disability, to prevent any problem, that is considered primary prevention. Okay? And we'll do a little survey. Maybe the link will be in the next, I can't be sure. But secondary is when you either screen for something and start intervening to treat it. You know, you have somebody who has the flu already, it happened. You cannot just go and say, we're going to give you the flu shot to prevent it. We're not preventing it, really. We're treating it. We put them in the hospital, or we give them fluids, we give them Tylenol, we give them this, we give them that, rest, all that kind of stuff. That's treating the symptoms, or treating the disease. Okay? Some diseases, you treat it, you cure it, and the patient goes home. You fix the problem in the community, and it's gone, right? But some problems will persist. Lots of the illnesses that you can see have long-term effects. They have complications the patient will have to deal with for a long time. That's where tertiary prevention comes into place. For example, if you have someone with diabetes, for example, and then one of the complications is diabetic foot, okay? And you want, some of those complications are starting to appear. And before deteriorating and then resulting in an amputation, you want to preserve that function. You want to preserve that foot. So foot care would be a tertiary prevention. That's where you prevent further complications, you prevent further deterioration in the person's health, okay? To give them the best shot at maintaining the current level of functioning. Rehabilitation. If you have a person who had a car accident and they lost sensation or movement somewhere, you send them to a physical therapy, a rehab center, to be able to regain or preserve some of the functions that are still there. Because sometimes if you don't, if there is a joint problem or weakness in a muscle, if you don't use it, what happens? You will lose it. You know that saying? If you don't use it, you'll lose it. That's pretty much the case. If a muscle atrophies, your joint will freeze, and the person won't be able to use it at all. If you put them in rehab, you can do special programs, assistance, and physical therapy, whatever that is needed to preserve the function of that organ or that part of their body. And these are some examples and they are not, I hope they're not, there's no answer in the sheet. But if we want to go back to the Moodle site, and here I'm going to open it right now, so just refresh your page and click on Levels of Prevention. poll. It's a quick one. Let's take a couple of minutes, work in pairs, and there's maybe 10 questions. It gives you an example, and you just decide what kind of prevention that is. And then we'll see the kind of the summary of your results and actually from previous students as well. So let's look at that. Let's take a few minutes.
Oh, I thought you said that. Yeah. Thank you.
Yeah, because like once
Well, do they are? Well, they're not
Forgot.
They already have like a company.
I'd say fine.
That was well, I think it is. That would be. Oh, yeah, you're right.
Look, go for it.
Is anyone still working?
I think the first one was on the one that we disagree on. it's tertiary, so it's secondary.
You guys in Rochester, are you done? Raise your hand if you're still working. Good to go? All right, so we have, wow, 200, well, this is not from today only. This is from previous, I think, previous semester as well. But, we'll just look here. This is very easy if you guys haven't used Google Forms before. You go to the responses and then summary of responses, and voila. Look at that. All right, foot care for care clinics for diabetics. I see most people thought it's tertiary, and I think that's the correct answer. And you got someone may or may not in this group has chosen primary, but I would disagree very strongly that it's a primary prevention because they already have diabetes. We're dealing with complications. If you wash your feet every day just to keep general cleanliness, that's a different story. Immunizations, primary, thank you. Cholesterol screening, there's always someone who might think, oh, we're screening, we don't know they have high blood pressure or high cholesterol. But again, screening is secondary. And I used to argue with my instructors about that. But we're trying to identify the problem. We're not trying to prevent it, okay? If we teach people to eat your vegetables, don't eat too much hamburger and you know, all the fatty foods and stuff, yeah, that would be primary. But we're looking for people who have high cholesterol. So you may or may not have it, but at least we will identify cases of people with high. So that's kind of the nutrition. Yep, primary. Yeah, I don't know what these people were thinking. Well, it's a free country. It's a free country. You can pick whatever you want. I'm a Simpsons fan. Anybody a Simpsons fan? Watch The Simpsons? No? Anyway, there's a fake doctor in The Simpsons, and they have like the state fair, and he has this revolutionary diet. Eat anything you want, eat all the junk food, and lose weight. That's his claim. So somebody asked him, is this really true that you can eat everything and lose weight? He said, it's a free country, whatever you want. So it's a free country. So you can think whatever you want, but it could be wrong, okay? Exercising to lose weight, okay? There's a little bit of a split here, right? Some people think it's primary. A sizable number thinks it's secondary. And some people think it's tertiary. Anybody wants to take the position on primary? I agree it's secondary. This is my opinion. Anybody in Rochester want to argue for primary? Not the Republican and Democratic primary. We're not talking about that. Just primary prevention. Yes?
Well, I can see where someone would say that it's primary because if you're overweight, doesn't necessarily mean that you have something as of yet, and so you're just exercising to prevent any further.
Yeah, that's a plausible argument. Wrong, but I still. It's a free country. Why is it secondary? Anybody wants to take the secondary? Someone who chose secondary, just tell us why you think that. We're not trying to embarrass anybody. This is just a joke, okay? I agree it's secondary, and I can defend that, but yeah.
I would say obesity in itself is a health problem, so we're treating that health problem by exercising, so therefore it's secondary.
Right, that's exactly right. Screening, like taking a scale and asking people in private to step on the scale to identify who's, like checking their BMI, for example. Height and weight, and you do the math, you get with a BMI number. And they will tell you whether they are obese or overweight or whatever, right? So that by itself is secondary. So imagine if we're exercising to lose weight. That would still even be more secondary than just screening. And it could even be close to the tertiary as well. But unless they have heart disease or cholesterol or something called the metabolic syndrome that might impact their health and then just start getting sick, and then we want them to prevent those complications, then it becomes tertiary. So it's kind of somewhere in the middle. It's secondary. And that's final. Car seats. We're trying to prevent injury and death of children, okay? So we're not trying to, this person who said tertiary needs to repent, really. Because this is way beyond, way before, right? I mean, the child is not like smashed into the car and we put in a seat there to prevent them from dying, right? We prevent that. And you can use a car seat, but in a lousy way, and it will not protect the child. So you need to, we will talk about car seats later in the lectures to come. Helmets, yes, very, very primary. Preterm labor evaluation. There's a trick one, another split. But most people think it is secondary because what? We're trying to find the problem. We're trying to identify. The person may or may not have a high-risk pregnancy, for example. But if they have high risk, then we caught the problem early and we can treat it. Postpartum depression support group. Are we preventing depression? Does the person already have depression? Yes. And what are we doing with the support group? They probably are already being treated for depression, and they go to the support group to what? To share experience, to share feelings, to shed some of that stress out, right? And it's especially postpartum depression or even perinatal depression is underdiagnosed and undertreated, especially in the US. There's a big disconnect between the physical need of the mothers. This is kind of another thought, but it needs to be looked at, and it is tertiary. Newborn screening. Screening secondary. Screen secondary, okay? Think of it that way. Health education. If you're a school nurse and you do all these classes to the students, teach them about, how to prevent disease, how to live healthy, and, eat healthy, all that stuff. Absolutely primary. The funny thing, I was at Walgreens the other day, and Walgreens is a pharmacy, right? Supposed to be pharmacy. But what do they sell the most? Junk food, right? All the candy and M&Ms and soda pop, and a huge sign that says, "Eat well." And right under the sign, what do you have? Coke products, candy, all sorts of sugary chips, and who are you fooling, really? Is it just by teaching people to do it, just telling them eat well, and then this is what you're offering? It's hypocrisy, if you ask me. Blood pressure screening. Secondary, thank you. OTPT. Someone has a problem already, they've been treated for it, and now we're trying to preserve function. PT, tertiary. Think of it that way. All right? Cool. Was that helpful? Thank you. Let's just stand up for a few minutes. We'll come back and finish this section, and we'll take a bigger break. Let's just kind of move around. Rochester, I can see you also. Get up.
Are you screening for it?
I already know.
She has no idea.
What's up, Dr. Bad?
I know, I should know.
I don't like it.
Yeah, she's in just too much.
He was adorable. I drove it. I thought it was adorable because I didn't have a single thing.
know for that fast.
Yeah, I didn't even want to try.
I looked up drive from Rochester. No, I've been out of the city since last weekend. I was gonna maybe go back on Monday.
See, I
I'm
was
like,
wondering if we were driving from Rochester to.
oh God, no, no. I was wondering if it was if you guys went to Rochester this morning, if it was bad going down.
I think it would have been.
Well, I looked at the forecast and it was like 36 mile winds.
Yeah.
That's not gonna be good. Last week when there was no snow, it was like 20-mile-an-hour winds. I could barely get through that one.
The car was like all over. Oh my god, yeah. When we were driving home on Wednesday.
Westminster?
Yeah. It was so windy.
Yeah, when I drove down there last Wednesday, it was bad going down. Yeah, like, I'm not going.
Are you heading back tonight?
I think I'm gonna go in the morning. Like, I don't wanna go, but I looked at the weather tomorrow and it's only supposed to be like 8 winds, so like I'm thinking I'll be better.
And the roads will be plowed, and they said like a chance of no lightning. But the guy on the volunteer yeah, so it was like
Yeah, it's just like today, even if I go after class, it's still supposed to be super windy, so it's still gonna be blowing.
yeah, overnight.
Yeah.
The morning.
You guys been well?
Yeah, the lab. The work was really nice. It was really
That's good. I was wondering how that would go. It's weather, like, I don't
And she told us that like you're not gonna was like travel advisories and stuff.
And there was still a travel advisory today.
You're not. I don't know where you are. Like
Drive slow. Some of the freeways down there are shut down.
yeah. All the main ones. I think that if our lab started at noon, we probably would have yeah. Like if our lab was
Yeah.
because the roads were still like
When you were
snowing when I was up.
where do you guys live in the cities?
I live like south of Lake.
Okay.
So I'm not. Further north.
So you have to leave at like 6 p.m. and like the advisory.
Yeah, we leave.
Number one for travel until noon.
We leave really early.
That's good though. I have to do that tomorrow. So last time I'd like go early just for the lecture. I'll always be late and I'm like, I can't stay for lab, but I always like
A little bit of
I should still probably do some practice because I'm booking the book. Yeah, we got like stuff I learned in class. I think she expects you to know the rules. Mostly. Like you did well on that week practice. I don't know.
I would have made a comment about being easy.
yeah, so
And I've already had first. Oh yeah, I already did not give us the
yeah, we did that. We were like because we thought like on the first calc. And like so it was just completely yeah, and we didn't know that. And
Oh, you didn't?
No.
Well, they told us last semester, right?
Well, I think they told us we just didn't read.
We didn't read it. Yeah.
That's exactly
That makes sense.
very good.
Yeah, that's part of it. And it's my last semester, like, we have to remember reading about the food.
Okay, so really excited that
Yeah, she gave us like
No, just
What I used to like for like
sugar.
yeah, dimensional analysis.
Yeah.
And they like mentioned integration proportion it's faster. So I like understand that, but now I'm thinking I'm gonna go back. The GA was
Yeah, that's what I do is like if I don't know where to put it, I just put it the opposite. So like if it's
Sydney wants to see us.
Funny.
Yeah, but there's places.
All right, let's take our seats back. We'll try to finish a little early today to send you home before it's dark. Is that better? Okay. I promise, we'll take another break. Rochester, you ready? I see myself in Rochester. You guys just transported. Oh, whoa, here we go. Awesome. All right, so as a professional nurse and a public health esteemed professional, you will be able to conduct a community assessment, and you guys already have, you can put that on your resume. You did a windshield survey, you know? I've never done a wind chill survey, but I like to survey other things, not the subject of today. I like to critique structures and buildings and roads and stuff. That's different hobby of mine. But for you as a nurse, you can be proud to say that you conducted a community assessment. And this process helps you in identifying problems, finding strengths of a certain community, finding weaknesses. Sorry to say it, but every community has its strengths and weaknesses. Or, in the more nicer way of saying it, areas of improvement. Okay? So if there is a problem, there are areas that could be better. You will see that from a health perspective, from a nursing health perspective. Okay? What the needs are for this community. Many people, did anyone do the Riverside area, Riverside and Cedar? You have, okay. It will be interesting to see what you guys thought the needs are of that community, right? For example, where the student housing, who did the Dinkytown? Anybody did Dinkytown this year? No? Yeah, it's always interesting to see what you guys think the needs are for these places, you know? From your perspective, what is a good thing to contribute to this community to improve its health and fix some of the problems? And what are the resources that are available? Are there clinics? Are there shopping areas? Is there a store that sells only junk food, or there's a grocery store where you can find, healthier options, right? So whatever these resources are, the resources as well can be the community members themselves. Is there a community center? Are there leaders in the community you can ask, you can talk to, you can have them as your helpers or allies so you can implement a certain program. So you look at the entire picture there. It's a logical and systematic approach where you assess different areas, not just one problem. And to do that, you collect data. And you have different kind of sources where you get your data from. Some of that is public domain. You can find information in the public health department or the national census or the city hall. You can have so many different resources where you can find those specific indicators that you need for the assessment that you're looking at. For example, access to care, some statistics about infant mortality, infant morbidity. What are these salient problems in this community, and what they mean for them. Maternal mortality, injury. If there is a neighborhood that doesn't have a lot of, say, parks and public open places for kids to go and play and run, where are they going to play? Probably out on the sidewalk or in the street, and that could pose a danger for them, and safety can be an issue. So all these indicators can be helpful. For example, access to health care. We'll talk more about the factors affecting the general health of the community, but access is very important. Is the community, is there, for example, public transportation, or are people driving mostly? Are there close by clinics or resources that they can use for health? What are the barriers? For example, on a day like this, for example, if you have a mom who's coming to a prenatal visit, or the snow yesterday prevented them from going, okay? And is there a public health, a reliable public transportation or not? In fact, public health and social work and people who do programs for to eliminate or to reduce the access or accessibility problem, they can actually contract with certain transportation companies or provide vouchers for family. For example, if a mom gives birth and she needs to go for a follow-up appointment, or come in for a prenatal visit and they don't have a car, they cannot afford riding the bus, or they have to work. So these programs can help with the accessibility. Is there health insurance, is that a problem? Are people insured or not? By whom? And whether it's adequate for their care. In addition to, there's always the rural areas that are forgotten and not many people want to, because it's not, again, if you are a healthcare organization and you want to make money, if money is the basically what you're doing, the people out 100 miles out of the city are out of luck sometimes. They cannot get to where they need to go very easily, right? And actually a DMP student, I hope many of you will be thinking about grad school. Just finish this first, but then you can go there. But it's a good thing, good food for thought for you. And what he's doing, actually partnering and bringing partners together from the big healthcare organizations within the Twin Cities, for example, and somewhere, I think 200 miles out, where specialists, nurse practitioners, surgeons, orthopedists can go like 1 day or 2 days to just offer help and see what the needs of these communities are. Instead of someone driving 200 miles to come here, why not move there and offer that specialty care to them? So these can be solutions you can come up with. Data collection, you have so many different sources, like I said. You could have access to a wealth of data from different sources. From the community itself, you can collect data from the state, from the county, from the city, all these places. There are lots of data online that are published. There are public information. And you cannot, of course, it's de-identified. It's not going to identify XYZ has this or that, but it tells you the general statistics about this population. If you look for a specific number or a piece of data, you'll be able to find it. And these are some populations you want to pay a little bit more attention to when you're doing your community assessment, because they are usually a vulnerable population that may or may not seek health care, because say if you're afraid to be deported, if you're an undocumented immigrant and you're afraid to be deported, right? You may not go and seek help if you need health care. Pregnant women, for example. And there are some populations that are more at risk. If a mother, there was actually a law, maybe we'll talk about this in a couple of weeks, where the screening for drug use of pregnant women, and if you're a drug user as a pregnant woman, you'll be afraid to go to have prenatal visits, because they will do the drug screening, and then you as the professional will be reporting them to the authorities, and then they get in trouble. They might take the baby away, and that, of course, didn't help really much. So that was thrown away. You'll focus on the health of the community. You're not the police to punish them. People cannot read or write, or immigrants or refugees. Those don't know where to go. They don't know what the resources are. Those can be a particular, the elderly, the children, those can be of particular vulnerability when it comes to population health. And the health assessment wheel, obviously we're not going to go over every aspect, but it's multidimensional. As you can see, some slices are bigger than the others, unlike what you get from Pizza Hut, but still, all areas are important. And it covers physical, emotional, psychological, education, sanitation, everything within a community when you're doing your assessment. So again, it's a holistic, overall look at a certain community. And I think there's more on that in the book, if I'm not mistaken. And see in the center here, you can see the state of wellness for the individual and the community in general, mental, physical, and social. So it's not just the physical health. You look at, social health and mental health as well. And these are some of the phases or steps of doing an assessment. And we do a methodical way, a very stepwise approach when you're doing your nursing assessment. If you have taken that class already, how to do a nursing assessment, you start with data collection. You put that data in a certain way to organize it and find what the problems are. Then you start designing a solution, implementing the solution, evaluating the solution. Those are pretty much defining the community, assessment, nursing diagnosis, planning. Again, you prioritize your solutions or steps of intervention, then you evaluate after you implement. But what I wanted to highlight, it's a stepwise process. That means we start with defining what the community is and what the problems are, but it's not just a linear process. Yes, it's a stepwise. You do one step after the other, but it's not just one direction. Sometimes you might make a mistake identifying what the problem is. That means you don't have to go through all the steps to find that out. You can just back up and start again. Or the implementation will teach you something about the effectiveness of this implementation and how you can improve it. So you do another assessment, so another detour back, and then you jump forward. So it's more flexible, more circular than actually a continuum. So you can go back and forth, and it's okay. That's part of the learning experience as a public health official, public health nurse, to learn from what you're doing as well. As you're the expert and you're doing what you know is right. But again, you could learn along the way better ways of fixing a certain problem or intervening in a better way to be more effective. These are some characteristics or hallmarks of a healthy community, and if we can see that in every community, that would be a great thing. And this is kind of our inspiration to always do better. When you have good health care for people, available health care, okay? Call me whatever you want, socialist, whatever you want, but I believe health care is a right for everyone. And no one should say, go bankrupt because of health care. You'll see that in the videos. I encourage all of you. I usually show some of it in the class, but you can view that on your own. The sick around the world, especially the interview with the health minister of Switzerland. And this journalist, he's a PBS journalist, he said, how many people in Switzerland go bankrupt because of healthcare cost? And the guy looks at him and said, nobody. What's the number one reason for bankruptcy in the United States? Anybody wants to guess? Thank you. Healthcare cost that people have to pay. When a patient goes home from the hospital, if any of you have seen Michael Moore's Sicko movie, it was like 10 years ago, another excellent movie. But maybe it's a little more ideological, but this one is very neutral. And he followed the patient in a hospital in London. And he kept looking, where is the money? When are you going to pay, the health care? And the guy kept saying, I'm not going to pay. And eventually, the patient, when they were going home, they went to a cashier's window. I said, aha, I gotcha here. So before he goes home, he's going to the cashier to pay the bill. And what the cashier did, actually gave him cash to pay for the cab to take him home. He was completely stunned. And that's happening. And here we have people are kicked out of the emergency room. There was a case a few weeks ago. A woman was kicked out of the emergency room because she didn't have the money to pay. And she died. This is shameful, to say the least. So, excellent health care. Children have safe environment where they can grow and play and develop normally. Okay? They have a lot of room to move around. Healthcare concerns are addressed We have collaboration between professionals. There's sharing of information. There's systems in place to prevent diseases and healthcare problems from the beginning. And if they happen, and they will happen, we have the tools to fix them early. Government, non-government, everyone has good intention, but not always good results. But working together as a collaborative group of people, whether you're a community leader or a member of the community, a healthcare professional, a government representative, or a business leader, whoever you are, when you live in a community, you want to make it better. And that's where the big deal is. Okay, let's just keep moving here. We'll take another break, I promised. This takes us to health promotion. And for that, we want to start with health as a definition, okay? There's another exercise I want you to do, and this is going to be really cool. Under the module of today, of course, we want to talk about health promotion. We want to define health, right? Health in one word. This is the shortest survey you'll ever have in your life. One word. Make it a noun. Because if you write a noun and then someone else writes that a verb, it looks as two things. We're going to put it in the word analyzer. It's called Wordle. Make it only lowercase noun. Lowercase noun. Don't write in caps or anything, because that, again, Wordle is not smart enough yet. I think there's a way to fix it, but I'm not going to spend the time on it. Just make it a noun, and or an adjective if you want, and just make it lowercase. Let's take 20 seconds to do that. Shortest survey in the world should be the shortest time too. Done? Done? Rochester? Done? It's okay, these are a little old. We'll take your words for today. 2, 3, here we are. Come on, guys. I see a few people going. It's weird when you see the words popping up. It's like a genie behind it. Don't cheat. Don't steal someone else's intellectual property. Everyone done? Okay. We'll take all that, copy it. And here's this. There's the magic. Where do we go? Wordle. Just copy everything in there and hit go. Ooh. Look at. Yeah, someone put a dash in well-being. The other didn't. It would have been all one word. Well-being is a big one. I guess well-being won the primaries, huh? And wellness, well-being, wellness. Okay. Those. Well, lots of W. All right. But again, holistic. We have holistic. All right. Someone capitalized. I said don't capitalize. Actually, there is a place to ignore. Leave words as spelled, mark all lowercase. Here we are. See, I know you could do that. So well-being and wellness. Well-being.
Just one, yeah.
Basically, well-being. So what is now my question is, how do you define well-being, right? Right? What is well-being? Right? Okay. So this is great. This Firefox is acting weird. So this takes us to the definition. What the WHO Sideshow from Karen. There are lots of news about health these days. These are little old topics, but some, it was measles like last year when they had this debate about to immunize or not immunize. People are speaking against it, others speaking. Just take a look at those. And, physical activity, how important it is, and not to sit down and not do any activity. And also lack of sleep, especially for your, young bodies and minds. You need to get some of that as well to preserve your well-being, okay? Don't be like me, because I can't sleep very long. I just got used to it. If I sleep more than 5 hours, I had too much. So, these are our objectives. Again, you'll take a look at them, but we'll keep moving. Now, the bigger, this little exercise, you will go in certain groups, okay? Maybe pairs will do, and then define health in a more expansive, if you will, way. And this will take you, cannot complete request, that's not nice. Would you like to define? Yeah, it's probably because of Internet Explorer. Okay, let's take a look back into the module here. Should be in there. Health. In your own words. Here it is. Show. So, what is health in your own words? Just click on this one. This should work. Don't worry about the stuff here. This is old. I thought I deleted it already. This is other people's work, so we'll take that off. Don't delete the first one though. Just add as many slides as you want. This is the power of Google, people. It's gonna rule the world. Get in pairs and just do. Here's the instructions. Just use pictures, use video clip, use a meme, use Vine, whatever you guys call them these days. GIF. All that fun stuff, just to show us what health is. Be creative.
Oh, wait.
Hilarious.
Can we like get this segment? I'm
Brains work better together. Collective brains.
Do we want to write it?
I wouldn't say pictures already. Have you ever done that before?
Change our thing.
That's just kind of, we found something really cool.
Oh, nice. You guys can do an interpretive.
You're the one who hyped me. She
Hey,
I knew
let's take one more minute, okay? To stay on schedule. All right, let's see your creativity. By the way, I have seen some of those pictures before. Other people have used them. All right, is everyone done? No? Okay, let's stop this for now. Because we want everyone to be done. Because if you edit after we start presenting, it's not going to show. All right, 5, 4, 3, 2, 1, done. All right, let's see. Taking care of yourself. Nice. Nice one, tough cat. Unnecessarily allows person to contribute to society. Okay, so looking at the person. Not exactly what you want to do, but if you have that body, I guess you wouldn't worry too much about the calories. Being happy, simply the absence of illness. Full potential, great. Feel good, holistic concept, encompasses. Don't worry, be happy. Who was that? Selena Gomez? I don't think I've ever seen her before, but just the name sounded familiar. All right. Full physical, social, emotional, and mental. Good. I'm going to go back to this one later. Okay, I see now. Health, cost of healthcare. So. Freedom. All right. Well, girls, boys worry about, public health. Don't worry about that. All right. Lots of Brussels sprouts. All right. Cool. Okay. Oh, YouTube video. I hope it's not 2 hours. Whoever put that in.
Oh, it's 5 minutes.
Hello, I'm Joanna Rohrbeck, Transfercise LLC. I'm here today to show you the
Fitness
hormones
work.
of Transfercise. I've got my ankle weights in place and my music's ready. So let's stop talking and do some walking.
All right. That's enough. We'll just move on. Here. All right, cool. The cooler group. He looks healthy and happy. Sleep. This is a catatonic state. That's wellness for you. Good brain. Nice. Strong. Cool. Boy, that's the wrong site for an IM injection. It's wiping the front, it doesn't go there. But anyway. And that's a huge needle for an IM anyway. Eating, exercising, health, right? Mind, body, soul, clean, neat. Nice. Is that chocolate in there? Balance. You get health here, you get health here, okay? This has been used before, I've seen it many times. All right, that's the end of it. All right, so we have a variety of opinions about health. And this is good. This is healthy to have variety of opinions.
I was like,
Close, close, close.
are you guys having fun?
All right. So again, this is the link, direct link here, and there's also a link in the module for, I think it might be a good time to take a little break again here. So hopefully we can send you home a bit early, but let's just get up and move again after all this laughter. Must have made you very tired. Freshen up, go wash your face or move around, up and down.
I really want to know. I'm not going to judge. That gave me energy. I'm lighter now. Are you guys? Okay, no, don't
That's so nasty. What kind of food is that? What kind of?
I feel like I do that every day.
What I meant with the break to get a little exercise is more than your thumbs. So like your legs, your arms, large muscles, not just the thumbs.
No, it's
Yeah. Yeah. Do 100 push-ups or something.
Yeah.
That'll be good.
Pants aside?
Did I eat there? Like 3 hamburgers.
That's your motivation.
I got before I did that.
Yeah, Rob's not.
Just a little bit. I can have it. I don't have it. You should.
Are you guys still watching that video?
You look like.
It's like one of those things you don't want to see, but you want to watch more.
And you cannot unsee it either.
Did you just say you can't unsee it? That's what I said. You can never get that. What is it? Yo, Peggy. Peggy. Is that mini version?
We don't know what this is.
Yo, watch this right now.
My sister showed you that.
Let's do it.
Look at that girl.
And she has no new friends, no. She's confident.
If you, whoever is in here, if you haven't answered the survey, I am healthy, I think, just click here. There is a link to it, it's a quick one. So just about few health habits. I'll show the results in a few minutes.
Are you watching for exercise then?
Yes, we are. She's killing me.
She's not doing her health hours.
She just said she's killing the game.
She didn't use her ankle. She did an ankle exercise. I know. Oh, I know.
I'm not doing it right.
Yeah, I just saw it. I'm way too skinny.
Sidra, you look like you're not doing more exercise. You ain't killing it.
Okay, everyone is back.
I know.
All right, let's take 30 more seconds.
I fired her real quick. She's working her ankles and her ankle exercise. That's all she does.
No, she's told so many times.
Just imagine.
Oh, like seeing if I'm happening or not.
Okie dokie.
What about Monday?
There's another, I know many of you completed this before the class, it was open early on. It just kind of tests or checks your healthy habits. So it takes the pulse of the whole class, so it's not going to show any individual responses. But I am healthy survey, it's called. I'm healthy, I think. So the link is right here, and you can take it later if you want. But we're going to show you the responses summary again. Of course, 160 responses also includes from previous semesters. And most people agree strongly or somewhat that they are overall healthy, which is good. Eating healthy diet. Most people are sometimes and most of the time, and there's still some number here, occasionally or hardly ever. You might want to work on that. Physically active. Almost half are most of the time and always. Another 15, which is about 10. 60% of you guys say either always or most of the time. And there is some room of improvement here, but generally leaning toward the positive. Sleep, good that we're seeing that most of the time 43%, but we want that number to be closer to in the always category, which is very few people do that, and it's important. I think this is always the area that most students suffer, which is lack of sleep. So you might want to go to bed a little earlier. Try see how that works and how you feel the next day. You'll feel great. Smoking, 1 out of 160, not too bad, but still, 1 is too many in my opinion. I think I'm going to save this and post it as a picture. All right, I'll go back down to part 1. Control Shift F5. Okay, that's it. I love shortcuts. So the WHO defines health, and some of your definitions definitely touched on this. That health is a state of complete physical, emotional, mental, social, not only the absence of illness or infirmity. I do have an issue with complete, because who really has a state of complete physical and emotional? This is an old definition in the 70s. That's what the WHO came up with. But I would say I would add to that or suggest saying a state of balanced physical, mental, and psychosocial well-being, where the person functions. Many of you touched on that as well, where the person is happy, in a good mood, productive. All these aspects of health are also important. But also the WHO adds or specifies some areas where these determinants of health are important, such as the social, economic environment, the physical environment, and also the person's individual characteristics and behaviors. Because, again, we have how many students here? If we ask each one of you, and as we saw, everybody has different aspect. Humor should be added to the definition, I think. But everyone has their own aspect of defining health and seeing it and practicing it. So not one definition doesn't really fit all. So it's it's like defining family. Okay. We're going to beat this horse to death and keep even beating it after it dies about health promotion and disease prevention. That an ounce of prevention is better than what? Never heard that saying? A pound of cure. Thank you. Well, it's better than a pound of whatever you want. But it's again, the focus of health is from the beginning. Consider that immunization, like I mentioned, is the ounce of prevention. It's better than spending a whole lot of money on a chronic illness later in life, or a disability, or tertiary health care, which costs a lot of money. So investing in the very beginning helps prevent bigger problems. And the best time to do that, obviously, even before a human being is born, and investing in that, the health of the mother and the child before birth, is that's really where it starts. And if you have a healthy mother, it's like you're planting a tree. You're planting, if any of you garden, you'll see if you have good soil, you have healthy soil with all the nutrients, the sunshine, and the water it and everything, you get really good crop. But if you have a really crappy soil like we have in Blaine, it's all sandy, it doesn't grow anything, only just the weeds and stuff, but you won't get a very good product. And that's exactly where you start, just preparing the environment where the baby is going to be born. And that's where, in the preconception phase. And there's a box in McKinney, diagnostic methods that may be used in genetic counseling. These are, like before things happen. You want to do, for example, a genetic test between, for the mother and father to see if there's any specific things that they are prone to and how we can prevent that from happening by early detection or prevention. So that's part of that ounce of prevention. And here we have a mother or a potential mother. She's 25, she's never been pregnant, and she is thinking about pregnancy. See, even, don't just wait until you start a family and you want to become pregnant, then you go seek advice. It starts way before. So she, according to her history, boyfriend of 2 years is supportive. They drink occasional weekends, and they eat out 3 to 5 times a week. That'll be a little too much. And she gained 50 pounds in the last year, and a BMI of 33. So all these health indicators, the health habits, the weight gain, the drinking, all these should count when you do your assessment. And she has asthma also, and she uses inhalers, and she has not had all her immunizations. What would you do as a professional nurse and you're giving advice to this woman who wants to become pregnant? Will you just say, yeah?
She should try to, either when she eats out or try to choose healthier places to eat out,
Right.
or cook at home.
So we need a teaching plan for her to teach her what is good about doing good nutrition, for example. Like limit the times you eat out. What else are we going to teach her? Yeah.
Maybe assess her physical activity and ask her to increase it.
See what kind of physical activity she's doing. Anything in Rochester? I see somebody writing. Are you just writing? Yes.
Get her immunizations so that she doesn't
Get the immunizations, and yes, absolutely. What else? What is, yeah?
So she has asthma and uses inhalers, so making sure she's doing that properly.
Mm-hmm. Doing her meds properly. And we want to also maybe consult with someone who knows about asthma medications, a physician who prescribes them, and what effect they might have on pregnancy. Yes?
I was just going to say that if she does become pregnant, she needs to realize that she needs to stop the social drinking, because alcohol consumption can be...
Yeah, what is the current recommendation about pregnancy and drinking? You'll see some headlines sometimes, they'll say, maybe not in pregnancy, but, the thing about alcohol is the consumption. Sometimes they say, oh, it's not too bad, oh, I think it's not good, but then it goes up. It's really unknown. But if you have somewhere where it's a shady or kind of a gray area, is it better to avoid it or to take the risk? That's kind of where, and what do you think a woman who has, or any person who has a BMI of 33, where does that go? Is that under healthy weight or overweight or obese? Okay. And maybe Linda or Sam touched a little bit on those maybe in the beginning or not. What risk does overweight have on pregnancy? High blood pressure. What else? Gestational diabetes. Thank you. So those could be all risk factors. And just jumping into that in this current state of health may not be the optimum condition for her. So you need to, again, set the stage, okay? Make the soil ready. Do the right thing beforehand instead of trying to fix bigger problems later. And one of the, complications of gestational diabetes would be a large birth weight baby, for example, and a post-term baby. And those, moms who develop diabetes during pregnancy have a really hard time delivering because the baby is too big. It might need cesarean section. The baby can be in fetal distress. You'll learn all about that. So why take the risk? So the best time is in the pre-conception, even before the family thinks about becoming pregnant. Keep that in mind. So in overall, in health, when we talk about healthcare, there are different models. And I can tell you, no two countries have identical models. Each country has their own system. They have their own values, their own ways of paying for healthcare. Some countries would advocate for a curative model, diagnose and disease and treatment and cure. Other places, or even within the same country, one state does this, the other state does that, where you look at healthcare in more holistic approach, and you treat the thing from the same problem from different aspects. Where do you think our healthcare system should be? A system that depends on diagnose a disease and treat it, or treat what's around it, or everything that relates to it, or treat the cause from the very beginning? Where would you go with what? Which one would you vote for? Anybody wants to pick number one? Anybody for number two? I see someone has a hand up. For two or one?
Two.
Two. It makes sense, right? Because if you say number one, I'll be really mad. Because again, we're beating that horse to death still. And that's the model. Number one here is the model that we are using. And it's not working. Lots of people, despite all the spending on healthcare, we're not as healthy as we should be as a general population. There's a lot of lots of holes that need to be filled there. And our stance as nurses are always advocates of holistic. We look at ourselves as holistic healthcare providers. We don't just look. A physician has a mission, and we're not, kind of blaming them, but that's their specialty. They have a mission, they have a disease to diagnose, and they treat the disease, the patient gets better, that's good. The physical therapist, the respiratory therapist does similar job by looking at a physical problem, but you as the nurse, you look at the holistic person, you look, and hence the name Care Families 2, or 1 and 2, and we look at the family as the unit. We look at the community if we're looking in a public health perspective. Okay, so more holistic, more inclusive. Whatever a quick example, if you have a sick child in the hospital and they go home, is that the end of the problem? No, actually that's just the beginning of their journey with the disease. Because you need to get on board the family, you need to get on board the visiting nurse, the public health nurse, or the home health nurse, whoever needs to be involved needs to know that this child will be going home. And if you don't include all these people, the school teacher, the school nurse, if they don't know, the child will end up coming back to the hospital again, and the whole cycle will start again. So, holistic approach. And we talked a little bit about carriers and access to health care and financial issues, cultural, gender, culture, geographic location, education level. All these affect how people see health, how they practice it, how they react to whatever is going to affect them in their health. And there are lots of other factors as well that people might be able to, afford health care, and they won't think about the financial aspect. Others, I know people who lost their job, and then they don't have any health care. So their, idea is, oh, I'm just not going to get sick. That's my plan, is not to get sick. Can anyone really do that? You're taking a huge risk. Because you cannot afford it, then you are not seeking health care. If you're afraid, or you're embarrassed because you cannot speak English, or you can't express what the problem is as a new immigrant or a refugee, you may not really know what your rights are, or how to ask for help when you need help. Those things, we might not think of too much, but they do happen in real life. Education level, it directly affects the nurturing and raising of children. Whether you know what is right in terms of when do we do the immunizations, what kind of nutrition does the child need, how much sleep they need, all these things that an educated person would be able to either know or find out when when it happens that they have a child, they raise a child, they read books, they educate themselves, they ask the experts. But someone who's not educated may or may not be that keen on finding more information as an educated person. And especially the educational level of the mother. Because traditionally, and that's changing, I'm not trying to be sexist here, but traditionally, moms are the primary care providers for the child at home. Whether she's working or not, moms are always, the babies are more attached to moms, that's nature. So, and the education level of the mother affects directly how the child's health will evolve in the future. Oh, I guess this is in this lecture, okay. Drug screening, like I mentioned it earlier, this was a law in Minnesota, and it was mandatory reporting of healthcare providers when you have a positive drug test of a pregnant woman to report it, okay? And did this help really? No. Like I said, you're not the police, okay? And you're not punishing people, you're not judging people. The people who kicked that lady out of the emergency room had no right to do that. You don't ask if you have health insurance. I have never asked anybody about health insurance, okay? It's not my job to confirm that they have health insurance. If they are sick, if they need help, if they need health care, we provide health care. That's our job. If you have a pregnant woman who might be using drugs, we do screening, and if you find a problem, we solve the problem. We don't just report. That was one of those flops that discouraged women from seeking health care in a prenatal setting, which made things worse for them, for their children when they were born. Did it solve the problem of drug seeking or drug abuse? No. It made it worse, and the impact was worse on the newborn. So it was thrown out, and you don't have to report that. You do have to collaborate with other people in your team to help this mother get over the drugs. We're not going to do the payers thing here. It's not. It's something really self-describing and self-explaining. It doesn't And there's a big, an explanation of the law down here on that same slide. I think the slides with the notes under that. So you can read that. Another healthcare public health problem is intimate partner violence, and it's kind of a hidden problem that when you're in a situation, whether being abused or abuser, you want to keep it secret, and not many people talk about that, and that's a huge health hazard. It could sometimes end in death or severe injury, and then the consequences are huge on the family. That's why we want to kind of learn what it is and try to prevent it from becoming a bigger problem. Try to solve it before it happens. If not, there are ways of screening. So if you work in a clinic, a community clinic, or a hospital, or any setting that you are meeting with your patients, you have a set of questions to ask. And those questions are standard, and they are mandated on you as the nurse to ask. But you have to find the right way, the right time to ask. When we talk about domestic violence, it happens anywhere. So it's not a shame, for a certain group of people or community. Among all ages, cultures, socioeconomic status, anywhere it happens. Okay, so don't assume when you have a patient who might look differently or might dress differently or whatever they are, you just ask those questions as you have to, and it could happen to both genders. So don't assume always the males are the perpetrators and the females are it's more often than not that's the case, but it could be either way. So don't assume someone because of their gender they are this way or that way. So the question is a question. You have to ask it no matter what. There is a little exercise, maybe we'll touch on this here. This is the intimate partner violence, IPV, the cycle. Okay, you can take a look at it. It happens with a stressor, and then there is some reconciliation, and then stress starts building again, and the abuse happens, and then there's kind of a calm period, and then another trigger, and it's a continuous process. And unless we break it, so like the public health triangle, it's like violence in the community. You have to intervene to break that, either by teaching, by protecting the victim, by removing them from that unhealthy environment, whatever it takes to protect. And here the benefit of screening, of course, screening for anything really, you prevent things from happening or deteriorating into a worse situation. It saves a lot of money, obviously, and also better outcome for the patient when you screen and intervene early. And you, as the healthcare professional, you would have a better sense of accomplishment because you've had a bigger impact on your community. And instead of just solving a problem, you would benefit a bigger number of people. There are steps when you are talking about domestic abuse. You have to screen, to ask what's going on, and there are a set of questions. Well, you'll experience this in a few minutes, okay? We'll have you pair up and then ask each other the same questions, and you see how you feel as the person who's asking and the person who is being asked, okay? You'll live in that moment for a few seconds. In the hospital, for example, especially taking care of children, when it comes to this part, it's always very awkward at some point. If the child is a little older, a teenager, to ask them while the parents are there to see if there is any abuse going on. So you want to pick the right time, like I said. You cannot just jump in and ask, if you have a 10 or 12-year-old patient and both parents are standing there, of course, it may not be a good opportunity to find out if there's any abuse going on. But if there's something going on and then you can discreetly ask while the parents are not there, you might be able to find something. Same thing with the partners. If a lady and her husband are there, whoever is a patient, and you want to ask them about abuse, it would be better to have privacy when you ask that question. And some people will say, why are you asking? Why? No, there's nothing. And it's probably true that there's nothing going on, but unless we ask, we'll never find out. So anything we're looking for, you need to ask. But if you don't ask, then you don't know. Screen, validate. When you have confirmation that there is something going on, then you want to validate that in terms of what exactly the experience is. You want to dig a little deeper to know what the dimensions of this problem, and then referring the patient to a specialist, to a social worker, someone, if it's a child, you can talk with your team, with child protection services, whoever is involved in this, in the care of this person or family, you want them involved, because now it's becoming a bigger issue than what you as a nurse can handle by yourself. We need other professionals to come in and help. So you would be the one who identified this problem, but the solution would be a bigger solution. In many cases, if it's a child who's been physically or sexually abused, then you would want people more experienced, people who have more qualification. You as the nurse, you can report it. You can have the social worker, you can have the physician, you can contact care coordinator to work with you on this case. And it becomes bigger, it becomes more of a legal obligation for us. Okay, so here's the practice. Now, 2 at a time, wherever you are, just, oh no, wait a minute. That's not the practice. This is the practice. Okay, so here, these are examples of people you might see in the hospital, for example, or in the clinic, okay? The first one, a well-dressed, articulate person, a woman, who is a manager at a clinic. And she walks in, and you're doing a health assessment. What would you, how would you approach this person in terms of asking questions? What would you assume about this person when they walk in and you want to ask them questions about physical or sexual abuse or any kind of intimate partner violence? Would this make you think, oh, well, she looks, very well dressed, she has a good job. Does that make any difference? Will you still ask the questions? The questions are right here. We're going to go over them. The next slide. Here. These are the questions. So just to give you sometimes how, it can be really, if you're not used to doing that, it can be embarrassing. It can be awkward, like I said. Have you ever been emotionally or physically abused? Within the last year, have you been hit, slapped, kicked, or all physical abuse? Does your partner force you into sex? Are you afraid of your partner or ex-partner? So these can be really very personal, very close to the person who's being asked. So when you see the first example, as opposed to a woman who is accompanied by a man and who is answering all the questions for her, how would you approach that? Okay, a woman who has 1- and 3-year-olds here in the clinic, and they're exploring the room. A woman who is a Native American. Okay, how would you approach these people, what would you say to the first one? Want your input. Someone in Rochester saying something? First one, what would you say?
Oh, we thought it was all.
I'm sorry? Come on, you guys wanted to go home early, right? Yes.
One time, my pediatric doctor, when I still saw her, she would just ask my mom to leave the room.
Mm-hmm.
Just say, okay, now I just need to ask a few questions only for her, so
Right.
we already stepped out for
Yeah.
a minute.
Very appropriate, yeah. So if this lady comes in, would you still ask the questions, yes or no?
Yes.
Yes. Doesn't matter who they are. About the lady who has a man who's accompanying her and answering all her questions, and he's not going anywhere. And you need to ask those questions, right? What would you do then? Just skip and say, oh, it's okay, we can do it later? Yeah, you can ask the person to leave. Okay? You ask him to leave and say, these are questions for her only, and I'm obligated to ask those questions in a private way with this lady. So doesn't matter who you are, the father, the mother, the husband, or the boyfriend, or whoever, a friend, or anybody, a neighbor, out. And some people might be resistant to doing that, and then you can use your authority. Say, I'm sorry, we cannot continue with you in the room in a polite yet firm way. You need to be outside while you ask these questions. Okay? How about the lady with two children with her? 1 and 3. Does that make a difference if she has children or not, to ask those questions? No. You might want, because she may be distracted, you might want to keep them occupied with something, give them some toys, or clinics have all kinds of distractions for children, and then ask those questions. I remember we were admitting a 14-year-old girl once to the peds floor, and she had her parents with her, and she had spent, like 6 or 8 hours in the emergency room. And when we were doing our initial assessment, of course, the nurse will do assessment and the physician. And both of us wanted to ask those questions, but we couldn't because the parents were still there. Okay, so we went outside, the resident and I, and said, did you ask the questions about no? Did you, we asked each other the same question, and we couldn't collect that information. And then we came up with a plan. We said, okay, let's just go in and ask the parents, hey, you guys have been really spending a lot of time since the morning, just sitting there. You must be tired. Why don't you just go up? The cafeteria is on the 8th floor. Just go grab some coffee or get some food, and then you can come back. And the parents said, oh, sure, yes. Then they went up. And that's when we both just ran in there. And they're very quick. Very quick question, have you been abused? Is anyone threatening you? These are standard questions in your assessment. They are in the chart, and even now, yes, no, in the electronic health record. So we both ran in, the physician asked the questions, and we were done within 2 minutes. And then the parents came back. So, again, you have to choose your time wisely. And then, a 14-year-old may think it's weird, but you explain to her that, this is part of the assessment. We want you to be safe. We want you, this is part of your health, and we want to make sure that you're, safe and healthy. So explain it to them why you're collecting that information. A Native American woman, or a black woman, or a Hispanic woman, whatever. Does that make any difference? No. Don't make any assumptions. Again, it happens. all ages, all cultures, all socioeconomic statuses, people with disability. We'll talk about more in the next course, the families too, about physical abuse and neglect and all that for children, but now for intimate partner, or it could be the parent. Yes.
Yeah.
Go ahead.
So if you are asking the child if they're being abused and whatnot, and if they say yes, how do you go about that then? Is that still a private matter, or do the parents get involved? Do you question the parents? Like,
we will then start observing. As if you suspect abuse for the child, absolutely, you are a mandatory reporter. But then you want to investigate a little bit. Depending on the age of the child, they may be able to describe it better, okay? But you don't just go and call, the police or the child protection just because a 2-year-old or a 3-year-old said they are abused. They need to understand what you're asking them. So based on the child's age and then our observation of them, what kind of illness they have, like I said, that's more in the next iteration of families, care families 2. You'll be taking that material. If you suspect child abuse, definitely you are a mandatory reporter. But at this stage, if you suspect something, you want to consult with others, see if the other nurses noticed something, or you talk to the physician and say, hey, I feel like the injury that this child has, or the fracture, or the bruise, whatever, that is not consistent with the story I'm being told. So you kind of do your own assessment or investigation to make sure you're not making judgment about certain people. And in some cultures, you might see something, a physical symptom on the patient that it may not be a sign of abuse. Some cultures practice cupping, for example. I don't know if anybody here has ever, for back pain, they do like hot glass cups, and the vacuum of the air inside pulls the skin up, and it looks really like somebody has been punching you in the back. And I know some cultures, Asian cultures, African cultures do that. So again, you need to have that sensitivity to what you might be looking. If the inconsistency of the story that the patients are telling you, the parents are telling you, like how did the child fall? And then, it's 6 months old and he just fell down the stairs. How would the 6-month-old go down the stairs? You need to put 2 and 2 together to really figure out what's going on. I know that's more than you bargained for, I guess, but. Okay, so let's take 2 minutes or 1 minute each and ask all these 4 questions to each other and tell me how you felt. Okay? Just go ahead and ask each other these questions face to face. One is the nurse, one is the patient, and then tell me how you felt.
I felt so bad, I was like,
Right.
I know,
Once again, one part.
Sure, why not? I've been physically Hey, that's not a question. That was a question anyway.
That's the wrong section. Like the anatomy of that,
It's a green juice. I'm surprised you're shaking. It's like so. It's like,
no, you gotta roll it. Get it?
Okay, your feedback. I see people smiling when they're asking or being asked. I wouldn't expect that in a real life situation, but what did you feel? When you were asked a question, how did it feel for you when you asked the question? Can't hear you. Or is that someone coughing? Anybody, when you ask the questions? Oh. Anyone else? Yeah. Intrusive. Right. You felt awkward, intrusive? Right. These are very intimate questions, really. I mean, you have to have the courage to ask them when you're, someone you just met, but they are your patient. So that's the relationship you have with them. Many people talk about when they are patient, the moment you step into the clinic or the doctor's office, you lose privacy completely, and it's very revealing. It's very, you're in a weak spot, so you want to protect that person as much as possible. That's why it feels intrusive and awkward. What else did you feel when you were asking? How about when you were being asked? How did you feel when someone is asking you about this stuff? No feeling? Yes?
I think especially just because these were so specific, it's
Mhm.
like, why would you even think that?
Uh-huh. Right. You wouldn't expect anybody to ask you these questions. And sometimes, depending where you work and what setting, they may not be exact same questions, but very similar. And they can be very invasive and troubling. I mentioned the question about, the thing about postpartum depression earlier, or the whole prenatal and postnatal period, and that many providers are not asking the questions. And because they know depression is, to many people, it's the stigma, or mental health as in general is a stigma. Imagine abuse, right? And one person who went through that experience said it wasn't that intrusive, because the physician who asked her said, "Are you crying much?" So in really gentle and very neutral terms, the lady was pregnant, and the doctor didn't say, "Do you feel depressed? Do you lose sleep?" Or all these terms that people associate with depression. But the doctor went just to the symptom and said, "Are you crying much?" Okay, and that was just the opening. That was just the door opener for a bigger explanation and bigger expression of depression that woman had. And that was just the window into her life at that moment. That's where the physician prescribed or referred her to a psychologist or a psychiatrist, and they managed to put that depression under treatment, and she felt better. So you as the professional, you might modify the question in a way, but still get the same meaning, so that you don't look or sound abrasive and too intrusive to the patient, because it's really a very close experience to the patient. How about someone else who were asked the question? How did it make you feel?
Well,
Yeah.
I've just been asked like this, just going to the doctors, like, do you feel safe? And like, I say yes, but it's like uncomfortable.
Right.
For me.
Exactly.
Like,
I mean, when I take my kids to the clinic, they ask about guns. Are there guns in the house? Okay. And I say, why would you think I have guns in my house? Like, I don't have. But they do have to ask those, right? And asking about safety, asking about if someone feels safe at home, in the neighborhood, all these are necessary, because you're assessing the environment where this patient or where this family lives, and that has a direct influence and impact on their health. And you could really find the issue early on, and then start strategizing how to solve it. And these are some of the ideas how people are dealing with this issue. And for example, the Massachusetts Medical Association came with the radar system, not the radar that catches you when you're speeding, but a different one. Routine inquiry, so let's just build it into the assessment form. Whether it's on paper or the computer, just routinely ask about it when you have a patient come in. And do your assessment. What type, how, who, all the details once you identify there's a problem. Okay? And then document it. Documentation is huge. You want to document everything as objectively and let the patient tell the story. And then assess again for safety. Are there any threats? Like I said in the beginning, it could result in harm or even death. Are there any dangers at home that could result in, really bad injury, like having guns, sharp objects, whatever? I mean, not the butter knife, but, still. Review the options. If the patient needs help, what are their options? What can you do to help them? A plan to, safety or even escape if they are feeling threatened. And again, many victims of abuse will not report it, because there is a psychosocial element, someone who's dominating them and abusing them. There is an economic, if I leave, or who's going to take care of the children, I don't have all these factors are built into this complex phenomenon, and then we come in to try to fix it. So we have to look at many different aspects of this problem. Okay, another example, maybe less depressing, is smoking cessation. And why we're talking about this, there's another presentation, you may have seen it under resources. It says optional resources within the module. And why are we talking about this? It's like for grown-ups or whatever, but actually now the primary target for marketing from tobacco companies are kids, whether it's here in the US or in other countries. They try to, because they know now grown-ups, adults know the risks. Many of them have quit and many of them don't smoke. That's not a good market. That's where they go into more susceptible, impressionable, whatever you want to characterize them, populations to market their products. And you'll see the marketing is heavier in poorer neighborhoods, in less income, etc. So the PowerPoint that's there, it's not really required, but you can browse through it. You see some of the glory, the old glorious days of smoking, and who was recommending what brand of cigarettes. Those are probably will shock you. So some of the when you're a health professional, you need to also ask about smoking, and you want to find resources for your patients in order to quit smoking. And these are some statistics about 70% of smokers see a healthcare provider. So you want to ask them about smoking, but it doesn't mean 70% of people who see a healthcare provider are smokers, but that's not the same as 70% of the smokers see a healthcare provider. And 70% of those smokers want to quit. So as a smoker, they feel like it's a bad habit, I want to quit, but they can't, okay? And half would try, and many would succeed, and many would fail. And some who succeed might go for a while and relapse. And so it's a continuous battle against that. So see the complete slides. This is an algorithm. When you're doing your assessment, asking questions, it depends what answer you get, and it kind of decides where you go from there. So if the patient, does the patient use the tobacco now? Yes, then is the patient now willing to quit? If yes, then you provide teaching, you provide a plan. And then if it's no, you go again in a different direction, just as a flow chart that would help you kind of a decision-making process. If the patient is ready to try to quit, that's when you kind of jump in and say, okay, let's work on a plan to quit. That's a very simple example of health promotion, preventing disease, preventing complications in your community. Finally, this here, the 5 or 6 A's when you have some smoking cessation issue, and that's the recommendation from or guidelines from AHRQ, the health quality research. I forgot the A, agency of health research quality. They recommend these to, when you plan an intervention, you ask the patient, you advise them to quit, you assess their willingness to cooperate with you. Basically, finding, similar to what we said in your community assessment, when you start defining the problem, finding a solution, implementing, and then evaluating. And then they add, following up, and then commending your patient for success by applauding them. And hopefully that would be successful when you try it. But again, it's a big problem, and especially for the young age, we do need to ask. Don't assume that a child who's 10 or 12 and you suspect they might be smoking, you have to ask those questions again. Okay? This brings us to the end of today's lecture. I hope it wasn't as boring as you feared. But if you have any questions, let me know. I'm here. If you want, if you have any questions or feedback. But otherwise, you are free to go. And be careful out there. Looks like the drive home is not as bad. was, for me, was an hour this morning, now it's 35 minutes, so the roads must have improved. And thank you to our staff.